Okay. So next up, we have the wonderful Emma Suzuki and Rory Keys. Emma is an exercise physiologist with an interest in making exercise and sports available for everyone. She worked in a forensic hospital to run activities for people with mental illness. Rory is co-designing the Accessible Knowledge Exchange Hub at the Centre and doing research on heart health for people with intellectual disability. Please welcome Rory and Emma.
Oh, yeah. Oh, yeah. Hello, everyone. I hope you're enjoying your time here at the conference so far. I'd also like to say hello to anyone online today and hope you're also enjoying your time so far. My name is Rory and this is Emma, and we are from the 3DN team at the National Centre of Excellence in Intellectual Disability Health at UNSW. 3DN stands for the Department of Developmental Disability Neuropsychiatry. We are here to share some information about heart health for people with intellectual disability and some information about the project at the centre. The heart health team consists of Scientia Professor Julian Troller, Associate Professor Rebecca Kontz, who is in the audience, myself and Emma. People with intellectual disability experience poorer health outcomes, and they are more likely to experience one or more co-occurring conditions such as type 2 diabetes and respiratory illnesses, and also subsequently more hospitalisations. As such, it is well known that they have lower life expectancy. Unfortunately, many of these health problems could have been prevented, and a major cause of preventable conditions for people with intellectual disability is cardiometabolic health or heart health.
So what is heart health? Heart health is this quite broad term encapsulating a wide range of areas in someone's life. Factors that may make some people with intellectual disability more vulnerable to cardiometabolic ill health than the general population include whether or not someone smokes, how well they eat or exercise, how well someone sleeps, their body weight, blood sugar or lipid levels, blood pressure, or whether their doctors have prescribed them on many different medications. It's important to recognise that heart health is influenced by far more than just your diet and whether or not you exercise. While lifestyle choices do play a role, broader social, economic and environmental factors can have a greater impact. These include where a person lives, the quality of housing, the neighbourhood infrastructure, access to safe spaces for physical activity, and availability of affordable, nutritious foods. Income level and financial security also significantly impact the ability to access healthcare and education, manage chronic conditions, and maintain a healthy lifestyle. Importantly, how individuals are treated by the healthcare system, particularly in relation to discrimination, communication barriers, and inclusivity, can affect whether people with intellectual disability receive timely and appropriate care. For people with intellectual disability, these determinants often intersect and compound, making it even more critical to address these barriers and inequities and provide tailored, accessible, and inclusive health services. So in 2021, the National Roadmap for Improving the Health of People with Intellectual Disability was developed. This roadmap identified key areas for improvements in the health and well-being of people with intellectual disability. And although there are a variety of factors that influence whether or not people with intellectual disability can enjoy a healthy life, it has been established that some health professionals lack the knowledge, skills, and appropriate attitudes required to address the health needs of those with intellectual disability. For example, medical students sometimes only get 2.6 hours of lessons on people with intellectual disability and how to deliver care for them. People with intellectual disability deserve fair and inclusive healthcare, especially for preventative heart health support. So aligning with the national roadmap to improve training, build better skills and build inclusivity, it's vital that qualified and emerging practitioners are equipped with the knowledge on the current heart health considerations that exist.
I'd like to acknowledge up front that this slide is quite a busy slide. It is intended to show, it's just intended to show what the final product may look like. This resource was designed specifically for clinicians, providing a quick visual overview of the heart health domains and corresponding interventions. There is an equivalent version for adolescents. What you are seeing here is the original 2016 step-by-step guide developed by the 3DN team, prioritising multidisciplinary care and reductions in polypharmacy and overprescribing mental health medications, based on the available evidence to improve outcomes for people with intellectual disability when they visit a doctor. It included a suite of resources, including toolkits and clinicians' training modules available for New South Wales Health employees. The 3DN team developed this resource based off of the resource for people with severe mental illness. It was originally adapted from a version developed by the Mind Gardens Neuroscience Network, a collaboration between UNSW, South Eastern Sydney Local Health District, the Black Dog Institute and Neuroscience Research Australia. Mind Gardens focuses on integrating research and lived experience to improve health for those with mental illnesses. In 2023, Mind Gardens Neuroscience Network updated their early intervention resource for people with severe mental illness to this one up on the screen. This, again, is a busy slide and there's no need to read everything. Following in a similar fashion, the Heart Health team will aim to update 3DN's original adult and adolescent versions. We are lucky to have many contributors from Mind Gardens for our project. And almost 10 years later, there is an urgent need to update these resources to align with the more recent and available evidence that has since emerged.
So our Heart Health project aims to update 2016 cardiometabolic resources to reflect the current evidence and guidelines and help provide health clinicians with clear, accurate and useful information on how to best support people with intellectual disability to improve their heart health. For our methods, we are conducting an extensive literature review, reviewing the recent evidence and guidelines on the considerations for prevention and intervention of the cardiometabolic factors for people with intellectual disability. Where there are gaps, the guidelines on the broader population will be considered. And for a more efficient consensus, evidence used from the Mind Gardens 2023 will be used unless more recent guidelines have been published since.
Following the development of updated guidance for each domain/risk factor based on the literature review, the Heart Health team and steering committee meet monthly to develop the initial draft of the resource. From here, we will conduct online meetings and ask for feedback from additional experts in the field, including GPs, nurses, paediatricians, psychiatrists and psychologists, and endocrinologists, as well as individuals and carers with lived experience. Through receiving feedback from multiple streams and individuals, the final drafts will be developed. Our steering committee informs us on changes we need to make to our work to make it relevant and understandable. The committee consists of some of the original authors of the resources we are updating, and they come from a range of disciplines including endocrinology, exercise physiology, nursing, psychiatry, dietetics, and occupational therapy.
So just to touch on some preliminary results, we are in the middle of the project and this may be subject to change. There is a significant gap in heart health guidelines specifically tailored for people with intellectual disability. Current evidence also suggests that people with intellectual disability are not excluded from the broader guidelines, but specific needs are often overlooked. Several recurring considerations have been identified across the available literature regarding how to best support heart health in people with intellectual disability. A key theme is the importance of engaging carers, families and support staff in both the education and intervention delivery. People with intellectual disability may often depend on others for support with decision making, daily routines and access to healthcare. People with intellectual disabilities involving their immediate support networks ensures that health-related information is reinforced consistently and applied in daily life. Another consistent finding is the need to recognise the heterogeneity of intellectual disability population. People with intellectual disability may have a wide range of cognitive or physical presentations, meaning that health interventions must be highly individualised. There is no universal solution, and programs that are not adapted to the person's unique communication style, level of understanding and functional ability are unlikely to be effective. This is best supported by multidisciplinary teams, and this type of care ensures that health delivery is holistic and responsive to the multiple domains that influence heart health. Finally, many people with intellectual disability experience complex health needs, including genetic conditions, which may be associated with congenital heart defects, for example, or reduced muscle mass. Others may live with epilepsy, gastrointestinal disorders, mental health conditions, all of which can influence health behaviours and medication use. Addressing these co-occurring conditions is necessary to ensure equitable, effective and inclusive heart health interventions for people with intellectual disability.
This is an example of the proposed changes for the adult smoking heart health domain. For reference, we are updating both the adult and adolescent heart health domains. The main structural change will be following suit of the Mind Gardens resource, using a traffic light-like system, with the red zone indicating the risk factor needing intervention, the intervention as indicated from the literature and guidelines, and the target. The other significant change is the expansion of the smoking domain as its own column. Noticeable differences in that domain are the inclusion of vaping, shisha and marijuana use, as well as the considerations for caregiver behaviours and individualisation of treatment plans. Our next steps are to complete the literature review, meet and receive feedback from experts and individuals with lived experience, such as carers, families and self-advocates, and finally meet with digital designers to bring our project to life.
Thank you.
Thank you.
Yay.
Anybody have questions? Has anyone got any questions? Just run up there.
Thank you. That's a very impressive presentation. However, there's one thing lacking, and it's the second most common cause of hospitalisation of people with disabilities, dental. And that came from your own research some years ago. I've just completed a research project on adults with Down syndrome. 75% had periodontal disease. Now, it's so well known in the dental community, we've been trying to put the mouth back into health for decades. Periodontal disease is one of the big risk factors for stroke and for cardiovascular disease, and also for diabetes.
Thank you so much.
Please include dental.
Thank you.
Thank you for that. Do we have any other questions or any questions online?
Yeah, there's an online question.
Yeah, there's an online question. Oh, sorry.
Kylie asked, are you going to have specific guidelines for people with Down syndrome, as we already know they are at higher cardiometabolic risk?
Yep, great question. So we do recognise that this group that we are talking about has a lot of variety. There's many different presentations and genetic conditions that come under this broad umbrella of intellectual disability. We don't have a specific resource that we are designing for Down syndrome. However, on the flip side of the resource, on the 2016 version, there are some specific risk factors and considerations for each genetic disorder, common intellectual disability presentations, and what doctors can look out for. So it won't be a separate resource, but there will be some information developed for that too.
I'd also like to say before we finish up, if anyone does have any further questions, feel free to reach out to either me or Emma on LinkedIn or email, or grab us here before the conference ends. Thank you very much.